Hello, I'm Dr. Daniel Farkas, and I want to welcome you to SIBO Natural Solutions. Again, I'm Dr. Daniel Farkas. I am a DC and a CFMP. I've been practicing for over 20 years, helping many people with SIBO, amongst other health issues that people wanted natural support for. So let's talk today about SIBO, small intestinal bacterial overgrowth. Now, what this pertains to is bacteria that belong in the large intestine actually sneak into the small intestine. Understand that in your whole digestive tract, about 90% of your bacteria are in your large intestine where they're supposed to be. They're only about 10% or so in the small intestine, and that's how your body's designed to function. Unfortunately, the SIBO, the bacteria, they sneak in from the large intestine into the small intestine, and they feast on the vitamins, minerals, and nutrients that are supposed to be absorbed into the bloodstream to benefit our health. And their activity, unfortunately, causes a release of gas, just like how we exhale carbon dioxide. Now, why? Why does it occur? Many reasons, oftentimes due to antibiotic or PPI antacid use. A diet that's high in low-quality carbohydrates, like this bad simple sugars, high fructose corn syrup. And a huge part is mental stress. You know, you hear a lot about health problems. They say, oh, it's all in your head or it's due to stress. This is one that is very stress-driven. And what happens is we get poor production of digestive enzymes and acid, which creates fermentation of SIBO bacteria, due to food not being broken down properly due to stress, slow gut motility, which is low intestinal muscle activity due to stress, and poor ileocecal valve function. And that valve is designed to act as a tightly sealed valve between the large and the small intestine. That can function poorly due to stress too as well. So chronic and acute stress, it's a big driver of SIBO. Now, some symptoms can be, of course, bloating and abdominal pain due to increased gas pressure, poor nutrition of the person with SIBO due to SIBO bacteria gobbling up all the nutrients before they can be absorbed, anxiety, brain fog, and other behavioral health issues due to the low nutrient effects and just the stress of having a health issue. Of course, constipation and or diarrhea. Oftentimes we see leaky gut too as well that contributes to immune system issues and food sensitivities due to the damage that SIBO bacteria cause to the small intestinal gut wall. Unfortunately, we see side effects from those that choose antibiotic therapy, and very frequently low iron due to SIBO bacteria eating all the iron up before it can be absorbed, and that results in fatigue. Now note, over 60% of people that have been diagnosed with IBS, called irritable bowel syndrome, which is chronic constipation and or diarrhea, they're positive for SIBO. Testing is crucial when you suspect SIBO or you have an IBS diagnosis. So when it comes to testing, the gold standard is what they call the SIBO 3-hour breath test. And it requires just a simple diet preparation, just an avoidance of certain foods. For a short period of time. Some people are coming off of certain medication regimens. They need to delay just a little bit longer sometimes. And pretty simple test. You just drink a special sugar solution, and as the sugar moves through the intestines, it encounters the SIBO bacteria. It makes them give off their gas, and then we're able to detect them. And all you have to do is provide a breath sample every 20 minutes or so over 3 hours, where you breathe into just a little plastic bag about once every 20 minutes. Very simple, and it can be done at home. And I stress, don't guess, do a test. I don't think anybody can guess what type of SIBO somebody has. The testing is crucial. Now, when we get the test results, that will indicate what type of SIBO may be present: methane, hydrogen, or hydrogen sulfide. And the results will determine which natural antimicrobials are in order. And now antimicrobials, those are natural things that kill off bad guy SIBO bacteria, which is very different than the pharmaceutical antibiotics. So antimicrobial is different than antibiotics. Now, the ordinary approach, very common, is to use antibiotics if you have or suspect SIBO. They, of course, have side effects. They kill off healthy good guy bacteria through the GI system. They can cause serious immune problems, digestive issues, and just a whole slew of new issues for people that are already dealing with SIBO. And the real problem is they have a 60% or more recurrence rate. That's where SIBO comes back 60% or more of the time. It's pretty frustrating. Now, the all-natural approach can include natural antimicrobials such as oregano, berberine, or garlic, competitive probiotics that compete with the SIBO that is attached to the lining of the gut wall to kind of scrape them off the wall and send them packing, gut wall healing and support using something called glutamine. Support for normal bacterial regrowth is crucial, as is the avoidance of foods that promote fermentation, that drive SIBO growth, such as bad fiber sources, aged foods, and more. Natural support also includes daily bowel movement support, very important while you're dealing with SIBO, using things like ginger and magnesium citrate. And understand that multiple rounds of 30 days of antimicrobials may be necessary. I tell clients be prepared for 2 to 5 rounds, depending on how severe their problems are, with retesting along the way. Again, I always encourage people get experienced professional supervision. Now, we have to talk about the gut-brain connection, because the brain controls it all. It controls enzyme and acid production that breaks our food down. It controls intestinal contractions and the ileocecal valve tone. Stress disrupts all of these. Now, the communication between the brain and the gut, it takes place across a nerve you might have heard of called the vagus nerve. The vagus nerve function can be assessed using what we call a functional neurology assessment. It's easy and it's kind of fun. The assessment may consist of observing someone's ability to hold their breath, their ability to even gargle, to do some simple balance exercises and some brain teasers. All of these things put together, they test the function of the vagus nerve, and this testing can be done at home. What do you do about it? You will then incorporate what we call brain-based therapies, which are simple vagus nerve stimulation exercises done at home, and that is a tremendous part of recovery for so many people. Again, down at the bottom, highlighted in orange, please get a professional assessment done so that you know what you're working with. This gut-brain connection is a huge, huge part of SIBO, and I've seen some stubborn cases that they did everything else right, but they ignored this part, or this part wasn't employed, and they just didn't get great results until they employed and honored the gut-brain connection and assessed their vagus nerve functions. Brilliant, brilliant, brilliant. Now, when all this is done right, what results can we expect? We typically see less bloating, less pain, ability to carefully reintroduce carbohydrates so that people can start to eat normally again, less brain fog, less pain, of course, flatter stomach, and a big decrease of IBS symptoms, especially the constipation, and diarrhea too as well. Go hand in hand. We see an elimination of stress and what I call the stress SIBO cycle, where people just can't seem to shake the SIBO. It causes more stress, more problems with the vagus nerve, and just a worsening that's really hard to break. We also gratefully see an avoidance of antibiotic side effects and reoccurrence when we take the natural approach. And we see iron levels normalizing and fatigue being really improved in people that have an issue there. So, what are your next steps towards recovery? I always encourage people, get a map of where you're trying to go. Use a map instead of wandering around, and obtain quality testing. Again, get experienced professional supervision instead of just trying to guess. So thank you for taking time to learn about SIBO and get a good foundation that I think you can build on towards recovery. Recovery is possible. Please contact us anytime. If you haven't done so already, we're at your service.